Hey folks, Michael Smikun here from Callagy Law, and I am joined by the wonderful folks at NJ Spine and Wellness, specialized in sports medicine, to bring you a message about telemedicine and being able to access medical providers, including occupational therapists, chiropractors, physical therapists, medical doctors, nurses, anybody that you could possibly need for any of your medical needs while we are all here quarantined because of COVID-19. And so I want to make sure that this message gets out to the people who are looking for telemedicine, the folks who are looking to hook up and provide their patients with access to telemedicine and the right kind of docs to be able to deliver the message. So we are joined here by Dr. John Cho, who is he's the medical director of NJ Spine and Wellness. We also have Joe Simone, who is a practitioner with NJ Spine and Wellness. And we're also joined by John Baker, the one, the only, the director of athletics there at NJ Spine and Wellness. So how are you doing, gentlemen?
We're doing great. Thank you. Thank you for having us.
So guys, before we launch into this whole telemedicine thing and how it all works, what's critical for you in terms of everything that's going on now with COVID-19 and how it impacts you as providers of healthcare?
So I'll jump in. I'll take that one if you guys don't mind. So, we've seen such a dramatic change really in our culture, that the public really hasn't been that public, right? Everyone's in their homes, but we know that there's certain medical conditions that don't go away. Certain people who are in pain, who have been dealing with, orthopedic injuries well before this coronavirus situation swept the globe, that those things just don't go away. So we've found that we have to be more creative to still stay in front of our patients to make sure that we can have them get better faster.
100%. So funny enough, I actually asked Dr. Cho and John Baker to move a little closer together, and their first response to me was, whoa, we're not practicing social distance. So we're going to keep this video to under 15 minutes to minimize the exposure before you guys. I think Joe is practicing correctly. He is as far away from you gentlemen as humanly possible. So I guess who wants to take this question? Tell me a little bit about NJ Spine and Wellness and what types of service it provided before the COVID-19 struck.
I think we could either rock, paper, scissors, or I'll take the before. You guys want to take the after?
Sure.
All right. So, before the coronavirus situation happened, all under our umbrella, we had chiropractors, physical therapists, acupuncturists, massage therapists, athletic trainers, medical doctors, nurses, spine and extremity surgeons. We really were that one-stop shop where someone could go physically, to treat for all of their medical needs. We had the multidisciplinary model where we believe that, 2, 3, 4, 5 heads are better than one, and really putting our patients' needs first, starting with what they are really looking to accomplish, and then reverse engineering their treatment plan, working backwards, delivering the individualized care that they need. That's our secret sauce. That's what we do, whether that's in person or telemed. But the change of the public perception of even being out in public has caused us to even revamp things, and that's why we're talking today. It's all about telemed.
Yep. So tell me a little bit about the lay of the land today and how it's been impacting your practice and how the delivery of telemedicine is changing the way you guys are practicing.
All right. So, naturally, as to be expected, there's less people who are out in the public, more people who are in quarantine. The cleanliness of our facility was always paramount for us, but we ramped it up even more. So using even extra precautions, increased uses of gloves, disinfectant. We ramped up even just the physical access of hand sanitizers through any of our facilities to make sure that our patients feel comfortable, our providers, or the whole team feels comfortable, and practicing those safe guidelines from the CDC.
Gotcha. So Dr. Cho, Joe, how has this impacted you guys from a clinical perspective or a treatment perspective?
Well, it's actually interesting for me just because I'm actually busier now than before COVID-19 hit. I think that one of the reasons is because patients are not able to come in for physical therapy, or they don't want to come in for physical therapy, the most conservative treatment. And now because of it, they're having increased pain. Wow. And they don't know what to do, and so they come to a pain management doctor and looking for help. And my response to that would be, stay home. If you could do home exercise programs, that'd be great. If not, come in, maybe we could assess you, and maybe we could try maybe trigger point injections, or maybe minor injections here and there. So it's interesting that I've actually gotten busier since this has happened.
And how about you, Joe? Is it the same experience for you?
It's a little different for me, I think. I am not as busy as I was before COVID, but I have been doing a lot of telecalls regarding pain and some home stretches and exercises that I review. Sometimes I send out a brace or even something called a TENS unit, which is like an electronic device to help minimize pain so they can have some control over their pain while being at home. And many times I link them to one of our therapists who can go telehealth with them and discuss various different exercises so that they can be watched, so to speak, at home and be monitored and make sure that the exercises are being done correctly.
So I think a lot of folks, right, are dealing with a lot of uncertainty right now, and more anxiety, more uncertainty for people. So like, I'm a patient, I'm like, wow, this sounds really different, very strange. I don't want to do this. I don't want to touch this. I'll just wait till the quarantine is over and I'll go treat with, a medical doctor or a PT when that happens. So by potentially explaining a little bit about the process and the mystery out of it, how would you create more certainty in people calling you up and saying, hey guys, Joe, hey Joe, hey John, like, how do we do this? How does telemedicine begin? I've called up. What happens next?
Well, most of the time the patient will call, they'll speak to our call center. We'll have all the information down of who they are and what's basically going on. We then arrange the telemedicine call. And at that point, it's sort of like an initial visit. We would sit down, we talk with them, but it's done via the computers and as we're doing it now. And we get the history, we get to see what's going on. We get to see if we need to order any advanced imaging or testing for them. A lot of these places are closed. Sometimes they can take some calls from us to see who's even open and we can get what's needed for these patients. Sometimes I have patients that calling that are in severe pain, and again, they can't do therapy or they don't want to leave the house to do therapy. At that point, I turn to Dr. Cho or other pain management specialists to try to be helpful to them, and they'll come in and we make sure we usher them right in so there's no waiting room, they're not around anyone else. We get them right in quickly. We get them seen quickly, keep the separation between other patients and staff, as well as even people like in the parking lot. We try to even keep them spaced there as well. So we try to do what we can for the patients, and we try to get them in quickly, like I said, so that they're not sitting around. And so far, we've been very successful at it.
Gotcha. So as a patient, right, I'm calling in now, and I got two questions. Question number one is, how do I know this is secure, right? I'm at home, you're looking at me in the camera. How do I know that the contact or the connection is secure? Like, do we have multiple doctors, multiple patients all in the same room working together? And number two is, how do I pay for this, right? Am I pulling out a credit card, and am I giving you $150 to $200 to get on the telephone call with you? Like, how do I pay for this? Is it secure, and how do I pay for it?
So from an infrastructure standpoint, right, so we have our standard process. If someone calls, like Joe said, to our call center, we get to know the person, find out what their condition is, what their really true needs are, so we can pair them with the right kind of provider. And that also factors in not only that individual patient's health, right, but their family. We had, a middle-aged mom who was treating with us who has relatives that are sick or relatives that live with her. That even though she would have been perfectly able to come to the facilities, we made the accommodations for her to switch to telehealth because she didn't want to put her family at risk, right? So taking into the 6,000 foot view of someone's entire situation and then retrofitting that appropriate solution for them, right? Telemedicine is not replacing what we do, but it's a great adjunct. It's another avenue, especially during this critical time, for people to get care that they need and not have that interruption, not just completely go without anything, right? So, all four of our offices in Old Bridge, Matawan, East Brunswick, and Freehold, they're still open to treat patients as we were in the state of New Jersey deemed an essential business. by Governor Murphy, and from the comfort of someone's home, right? We can do these video calls to really deliver that healthcare for patients. However, I want to say that we are using Ring Central, which I've been with the company 5 years. It's been well before I even joined the team. Ring Central was our internal phone system, where we have the enterprise option where it's HIPAA compliant, and through that platform, there is the option for video calls. And just like when Dr. Cho and Joe Simone are documenting the interactions with our patients in our secure EMR, same thing for telehealth. So all of the patient's information, whether they're seen in person or through telemedicine, it's all going to the same place. It's all going through that standard process of protecting someone's information to the maximum extent possible.
Gotcha. So what I hear you saying, John, is it's secure, it's safe, it's HIPAA compliant, and it's affordable, and you guys will help prospective patients to figure out whether or not their insurance is covering it, and to work with them to make sure that they are continuing to get treatment even in this crazy time when everybody's being told, stay home, don't leave your house. Is that fair?
Exactly.
Yes.
Unbelievable. So I'm going to leave the last word to you guys. Joe, Dr. Cho, John, last word.
Well, everybody, weird times right now. I'm getting stressed out too sometimes, just because of what's happening. But stay safe. We're here for you. We'll take care of you. If you can't come in, we could talk on the video conferencing like this, and try to assess the situation so that you don't get exposed to any kind of unnecessary risks. So let's just try us out and see how we are, and we just want to get you better.
Amazing. Thank you, gentlemen. I want to just put this out there that I've known the folks for NJ Spine and Wellness for years, and they are absolutely tremendous in this space. They perform the highest level of service. They're just wonderful people all around, and they not only work with your body to get you healthy, they're also tremendous in the mental space and the emotional space. So in Dr. Cho, I think you have to have a session with Mr. John Baker, who I know is tremendous in the space of emotional health and well-being. Your anxiety. So even the medical doctors need assistance at these times as well. All right. And I just want to say thank you to you guys for being open and exposing yourself to potential risk here to make sure that your patients are being taken care of and that their pain and their symptoms are being treated at a time when, not a lot of medical offices are open. So I just want to thank you guys for your time.
Thank you for having us.
Thank you very much.
Amazing.